Dr. Joseph Axelrod, and I am in the Department of Gynecology and specifically Gynecologic Surgery here at Christus St. Vincent.
I'm Dr. Stephanie Fine. I'm a breast surgical oncologist, also at Christus St. Vincent, and I work primarily through the Cancer Center.
Where were you previously before Christus?
I was at University of New Mexico, for 10 years. Prior to that, kind of in and out of the state, including Presbyterian, but I have been in surgery and doing, surgical work for 25 years.
I was just outside of Denver. I was working in a private practice at a community hospital, and before that I was in Chicago working at a teaching hospital for, well, I won't tell you how many years, but for a couple of years where I was working with residents and medical students.
And what are some examples of surgeries that you would perform?
Yeah, so we can do a few things in the office, but the remaining procedures are done in the operating room, and I utilize the robot, so it's really beneficial for patients. The recovery is much quicker, it's much safer, the surgeries are quicker. I'm able to do more with the robot. We're able to do hysterectomies and remove scar tissue, fix endometriosis, do support procedures where we kind of support women who have prolapse. We can support their internal organs and fix bladders, all those things, which are a little more difficult to do open, and frankly, the recovery is onerous and it's just not ideal. So the robot has just been a fantastic tool for me and beneficial for the patients as well.
Fine. What drew you to surgery as more of a specialty?
Specifically breast surgery. I transitioned to breast surgery actually after my initial career of doing general surgery, abdominal surgery, that scope of procedures, because I was seeing more and more breast cancer patients in my capacity as a female, operator. And in those days, we didn't have as many specialists in breast oncology, surgical oncology, like we do now. So my days started out full with breast cancer, but when breast cancer started to really get the research funding and things changed and how we approached it changed, and we started utilizing more of a team approach with many disciplines kind of weighing in on how to go forward with breast cancer patients and treatment, that really changed both my interest level as well as I think the amount of time, much like Dr. Axelrod is describing. You need a certain amount of time to stay really involved and up to speed on a specialist menu, basically, program. I will say that I'm walking into a very robust program as it is. Dr. Jambakar, my partner, has brought together some very good things for our community cancer program, including a more developed, robust genetic testing program, some additional surgical techniques that I think have been wonderful, benefit the community, benefit all of our cancer center recipients. So really happy to kind of build on that, and I'm really glad to be here.